Unfortunately, a lot of us are going to experience acute back pain at some point in our lives, and I thought what I would do is give everybody a few tips on how to manage that really acute phase where you're really uncomfortable and struggling to move. Before I start, I really need to stress that the very best thing you can do in this situation is go and see a quality physiotherapist who can assess you and give you some treatment recommendations and help you out with your pain. You may also need to see your GP. If you've watched any of our other videos before, you'll know about a little muscle called multifidus, which is really important to address the multifidus muscle as part of the recovery from back pain. Otherwise, we tend to see that back pain issues become a little bit more chronic. If you've watched any of our other videos before, you will have seen one about a little muscle called multifidus, which is a really important muscle to know about if you've got back pain. So if you haven't seen it, definitely check that video out. Quick disclaimer, with the information in this video and our other videos and the exercises that we show you in these videos, they're constructed as general advice only. If you choose to try the exercises or any of the treatment tips at home yourself, you do so at your own risk. We strongly suggest that you seek professional advice from your physio or, if need be, from your GP. If you feel anything other than what we describe in these videos, you should stop immediately and you should seek professional advice. If you feel any increase in your symptoms, pain, pins and needles, numbness, or anything else that you find distressing or uncomfortable, you should stop any exercises or self-release tips or anything else that you were trying immediately. And finally, the most important part of recovering from some of these issues, like back pain, like knee pain, like pelvic floor issues, like a range of the issues we're going to cover in videos on our Patreon page, you will be best served by going and seeing a quality physiotherapist who can directly guide you and help you and provide treatment. Okay, so now we've got that done, let's get on with the tips for helping you recover from acute back pain. The first thing is heat. In the vast majority of cases, heat is your friend. It is very, very rare that ice is the way to go with acute back pain and acute back spasm. Ice we tend to use more when there's swelling, inflammation, or there's been an acute injury. Often what happens with back pain is there's a lot of muscle spasm. And when a muscle contracts, it doesn't get as good blood flow, and that blood flow can stop it from flushing out the calcium that keeps telling the muscle to contract. So what we need to do is stimulate blood flow to that area to help the blood flush out the calcium and let everything relax. The best way to do this is with heat, because heat causes your veins and your blood vessels to open up. And so I'm going to show you my favorite heat packs here. One is a really long wheat bag. I love this one because it's the full length of my back, so I can lie on this one in bed and rest without being forced to lie in some weird, uncomfortable position because my heat pack is a strange shape or doesn't extend the full length of my back. It's also nice because then I am getting heat to all the muscles in my back all at the same time. I also love these little Hot Ease hot patches. They're a little bit like a sticker or a sanitary pad. You peel off the backing and you stick them on. You do not stick them onto your skin because then you get skin reactions, you can get burns, and often people sweat them off. What you want to do is, if it's more your hip and your buttock area that's sore, you want to stick it onto your undies and then have your pants hold it on into the right spot. If it's more your back or your shoulder, you want to wear a tight singlet. Stick the Hot Ease onto the singlet so that it's over the area that's sorest, and then just put a normal t-shirt over the top so that it stops you from knocking off the Hot Ease as you walk around. They take about 20 minutes to warm up, and then they stay warm and give you really good consistent warmth for about 12 to 18 hours. They are one use only. You're not supposed to use them overnight or during pregnancy, but these are a great option. Particularly when traveling, I use these, although nobody's doing a lot of travel right at this moment. You can get these kind of wheat bags or Hot Eases at the clinic. We can also post them to you if you call 9416-4410. Pro tip, when using wheat bags, you need to put a little bit of water in a mug in with the wheat bag as you heat it up in the microwave. And it's best if you rotate the wheat bag a couple of times while you're warming it up. This stops it from getting hot in one area more than the other, and it also stops the wheat inside from drying out, and it reduces the risk that you will have fire-related issues. Pro tip, when you put your wheat bag in the microwave, you need to put it in with a little mug with some water in it. In terms of what rest position is best, this is something we often get asked because it can be really difficult to get comfortable, and you need to be able to get comfortable in order for things to be able to relax and settle a little bit and to get your body out of that state of alarm. This is the reason why I love this hot pack. If you're at home and you're in bed and you're struggling to get comfortable, if it's more your back that's sore, usually lying on your back with numerous pillows propped up underneath your legs so that your legs are bent up but completely relaxed on the pillows is the most comfortable position to go into. Often you will need a number of pillows underneath your knees, and this just helps take the pressure off the back and off the pelvis a little bit. If it's more the pelvis that's irritated, usually people are more comfortable side lying with the sore side of their pelvis on top and a pillow between their knees. Obviously, there's no one rest position that works for everybody, but these are general rules that will help most people be more comfortable. Rocking or appeasing is one of the most important exercises that you can do in this early phase recovering from back pain, and it's called appeasing for a reason. Obviously, there are going to be some cases where people have really severe acute disc and nerve issues where they're not going to be able to do this, in which case, once again, you should seek professional advice. So rocking or appeasing can be done on the floor or in bed. You lift one knee at a time, never both at the same time. So you grab your left knee first, then your right knee. You don't have to cross your ankles, I generally do. And then you want to slowly rock your knees up and down. Small ranges, you can go up and down as you rock a little bit side to side, but you want the pulsing motion to be slow and rhythmic, kind of like a nice heartbeat rate. You wouldn't want your heartbeat really quick, so just go at a nice 1 pulse per second pace so that your body can start to relax. Initially, when I start this, I start with my knees roughly over my hips, and when I'm in this lower section of the back, I can feel little knobbly bits poking into the floor, and there's some stiff joints. And so I spend a little bit more time rocking on those stiff joints. And then gradually what I do when I'm doing rocking is I slowly bring my knees up a little bit closer to my chest. But I don't start off with my knees close to my chest. Sometimes the first 10 to 15 seconds can be a little bit uncomfortable as your body tries to work out how it's going to relax. If it doesn't settle down after that 10 to 15 seconds, you need to stop the exercise, but it should gradually become more and more comfortable, and you should be able to happily do this for 60 to 90 seconds, and you can do this exercise multiple times per day. When you're finishing this exercise, you lower one knee straight to the floor at a time. You do not stretch the leg out so that you have to hold the weight of your leg up. Just put it straight down on the ground, one at a time, not both at the same time. Once again, the most important thing to do if you've got acute back pain is to seek professional advice as soon as you possibly can, and make sure you see a good quality physio like the ones at Sydney Advanced Physiotherapy. I hope you found this video useful. Let us know below in the comments if you have any questions or if you have any future topics you'd like us to cover.